Chairman, let me start over in just a moment
Certainly.
because the recording was delayed. So I'll start over with the roll call, beginning with Roger Folsom,
Here.
Tommy Hopkins,
Here.
Norman Boyd,
Here.
Cynthia Rucker, David Cruz, Anthony Williamson, Shane Mobley,
Here.
Robert Coles, Kathleen Ruth.
Here.
Chairman, that concludes my roll call, and we do have a quorum.
Having verified a quorum, I'll call the meeting to order. Dr. Hopkins, will you review the minutes and make a motion if you so approve?
Mr. Chairman, the minutes have been sent previously to the members of the committee, and I make a motion that we approve as written.
Do we hear a second?
Second. Kathleen.
Dr. Riff has seconded. We have a motion and a second for approval of minutes. All those in favor signify by aye.
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 All opposed, no. Motion carries. Minutes are approved. Thank you. It's difficult to believe we're about to embark on the summer of 2025 already, but here we are. And in the interest of the heavy agenda we have this morning, we have a plethora of items to consider for initial adoption and a couple of reports that we'll be interested in hearing. So we'll move right on into the meeting and we'll move to the commissioner's report. Commissioner.
Good morning, Mr. Chairman. Thank you, and members of the board, and good morning to everyone joining us virtually. Thank you all for accommodating this new date in May, as we opted for a few more days to allow for the governor's 40-day bill review and signing period to conclude. We were actually able to join the governor, fellow state agencies, and dozens of legislators at the signing of this year's Appropriations Act just about 10 days ago here at the Capitol. And much what you see on the agenda here today, as the chairman alluded to, is our attempt to quickly implement and execute and lower our chair on those items. On those items that were enacted over these past few weeks. As always, I want to thank the finance and policy teams that are responsible for the financial modeling and important discussions to go not only to the legislative conversation, but on the implementation side of how we actually put these things before the citizens of Georgia. One update I'd like to acknowledge is that the public comment period on recent CON rules have been extended until this Friday, and to allow for all the input to be received and assimilated here at the department. So please stay tuned for our website for continued updates on those. And the board could expect those items available for final adoption at a subsequent meeting. Pivoting from state to federal matters, I'll be remiss if I didn't acknowledge what many of you already know, and that's that there's a real-time discussion going on in DC regarding federal spending in general and Medicaid specifically. As many of you know, the U.S. House took action last week on some early versions of the bills that do in fact affect several of our programs. Eligibility for Medicaid, SNAP, and TANF, directed payment programs, provider fees, qualifying activities for participation in Medicaid. Make no mistake, there are several items in these legislative packages that would impact our programs. And we are fortunate to have relationships across DC, as does the governor's office, that provide us with a constant flow of information on what is being contemplated and the potential impacts here in Georgia. And in many instances, we've been able to see our input factor into the discussions going on in DC. But we are very early in this process. Margins across Congress are slim. Negotiations between party leaders from both sides of the aisle are constant. And as you would imagine, the legislation will eventually make its way to the U.S. Senate. And that will begin a whole new round of negotiations and conversations. Then at some point, this will all culminate in negotiations between the House, the Senate, and the White House. So we'll continue to devote resources to staying abreast of what next steps should be and share the potential impacts to our state where and when we can. But we are very early in this process, and we'll all continue to monitor it together. And if I may, Mr. Chairman, I'd like to acknowledge a few celebrations around the department. Late last week, Our Medicaid Director, Stuart Portman, and his wife, Rachel, welcome the new addition to their family. We're pleased to report that Rachel and, as Stuart says, baby boy Portman are healthy, and that big sister Charlotte is very proud and excited to have them home. Stuart will obviously be taking some well-deserved paternity leave, but the team at MAP is very supportive of him taking some time and have also made accommodations to make sure all operations run smoothly in his absence. Additionally, this will be our Deputy Commissioner Grant Thomas's last board meeting as a bachelor. Grant and his wonderful wife, Miranda, are slated to be married on the 31st of this month, and we're obviously excited for them. And if he does, in fact, return from his honeymoon, we'll welcome him back later in June to resume business. I'd also like to acknowledge the numerous families across our broader DCH family who are celebrating various graduations these past few weeks, to include Denisha. Whether it's preschool, high school, university, graduate school, we're definitely seeing the graduation season alive and well in our hometowns, and know that many of our colleagues here at DCH are experiencing very close to home. So congratulations to all of your families, and please enjoy this season in your life. Lastly, I'd like to congratulate Jocelyn and our wonderful HR team for leading a week full of activities for Public Employees Recognition Week. Awards, pizza, bingo, putt-putt, something going on constantly around the building, and I think that helped all of us recharge a little bit and celebrate one another. And I'd like to thank SHBP, I see Lewis here in the front row, for a successful mental health summit in Brazelton last week. That's our second of many. It's been a successful program that has so much interest from practitioners, SHBP members, our vendor partners, and obviously the legislature has been very supportive of activities going on in school settings and across state employees. So a very relevant topic. And you had such a knowledgeable and substantive program put together, and we're very grateful for it. So I know that was a little lengthy, Mr. Chairman, and as you mentioned, we have a full agenda. So thank you for your time. And at this point, I'll hand it back to you, sir, for the remainder of the agenda.
Thank you, Commissioner, and certainly our regards to both Stuart and Grant. Stuart's purchasing diapers and Grant will be purchasing rings, so it's good for the economy of the state. So
That's right.
we will move on into the agenda. First item on the agenda to consider for initial adoption is the increase of reimbursement rates for autism spectrum disorder therapy. And Brian Dowd will be presenting to us. And Brian, we're going to give you quite a workout today, it looks like, from the agenda.
Yes, sir. Thank you. Thank you, Mr. Chairman, Commissioner, members of the board. The first item I am presenting today for initial adoption is an increase in reimbursement rates for autism spectrum disorder, or ASD therapy. Pending approvals by the Centers for Medicare and Medicaid Services, the Department of Community Health proposes to increase rates for ASD services by 3% effective July 1st, 2025. The 3% would be applied to all service codes offered in the Medicaid and Peach Care for Kids program under the ASD therapy category of service. The change is in accordance with the budget as passed in this legislative session. The cost impact for this change is estimated to be $5,405,117 in state funds, with a total fund impact of $16,043,684. An opportunity for public comment will be held on May 27th, 2025 at 10 a.m. via Zoom audio. Comments are due to the department on or before June 3rd, 2025. I'll pause now for any questions and will respectfully request your consideration for initial adoption of the increase in reimbursement rate for ASD therapy.
Any board members have questions for Brian? Hearing none, would there be a motion for initial adoption?
Make the motion
So
for
moved.
approval, initial adoption, Norm Boyd.
Second.
I have a motion and a second for initial adoption. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
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 Any opposed, no. Anyone abstaining? Motion carries. Okay, Brian, we'll move to your next item, which is the increased reimbursement of rate calculation for emergency air ambulance.
Thank you, sir. My next item I'm presenting for initial adoption is an increase in reimbursement rate methodology for emergency air ambulance. Again, pursuant to the budget bill passed in the 2025 legislative session, DCH seeks to submit a SPA to the Centers for Medicare and Medicaid Services effective July 1st, 2025. In the existing state plan, when emergency air ambulance is needed, we get quotes from the provider and we take the lesser of three factors. That's the provider submitted charges or loaded miles times $16 plus $2,573 or a fixed rate of $3,300. That's our current methodology that's in the state plan. It's historically been there for a very long time. With this SPA, we seek to modify the state plan to make a reimbursement rate for rotary wing increase in the second factor. So we'll still look and compare provider submitted charges versus the 3,300 fixed rate. But instead of doing loaded miles times 16 plus $2,573, we will change that methodology to loaded miles times $21 per mile plus $2,573. The cost impact for this change is estimated to be $249,004 in state funds, with a total fund impact of $762,466. An opportunity for public comment will be held on May 27th, 2025 at 11 a.m. via Zoom audio. Comments are due to the department on or before June 3rd. I'll pause now for any questions and would respectfully request your consideration for initial adoption of the increase in reimbursement rate for emergency air ambulance.
Any questions for Brian? Hearing none, is there a motion for initial adoption?
Tommy, so moved.
Have a motion for initial adoption. Do we hear a second?
Second.
Norm
Go
Boyd.
ahead.
We have a second from
Second from Norm Boyd.
Norm Boyd. Okay. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
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 All opposed, no. Anyone abstaining? Motion carries. Okay, we'll proceed to the next item, which is similar. Rate methodology change to modify the reimbursement calculation for emergency ambulance. Brian?
Yes. Thanks, sir. The third item is a rate methodology change for emergency air ambulance services, which is basically ground transportation. In accordance with the budget bill passed in the 2025 legislative session, DCH seeks to modify the Medicaid state plan. Oh, no, I apologize. This is not in the Medicaid state plan, and that is a very important point. For this, it is simply a policy change. So we'll be making the change in our policy, and because it's not specifically outlined in the Medicaid state plan, it does not go to CMS. We are still required to do the full board notice as it's a rate methodology change so that we can present it to our board and get public comment. So the current reimbursement methodology for emergency ambulance services calculates mileage reimbursement after the initial 10 miles of transportation. So you start counting mileage essentially from mile 11. Historically, we've had the 10 miles of transportation as what we've called included in the base rate for all transportation. But effective July 1st, 2025, DCH will remove the calculation methodology requiring providers to disregard the initial 10 miles of transportation as included in the base rate. Providers will calculate miles from the initial point of transport for members, and no modifications are made to the base rate as part of this policy. The cost impact for this change is estimated to be $5,993,243 in state funds, with a total in funds impact of $17,789,111. An opportunity for public comment will be held on May 27th, 2025 at 3:30 p.m. via Zoom audio. Comments are due to the department on or before July 3rd. And I will now pause for any questions and respectfully request consideration of initial adoption to the modification of reimbursement rate for emergency air ambulance services.
Any questions for Brian? Hearing none, is there a motion for initial adoption?
So moved.
Have a motion, is there a second?
Sam Mobley seconds.
Have a second from Mr. Mobley. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
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 Any opposed, no. Anyone abstaining? Motion carries. We'll move to the next item, Brian, which is increase the existing payment for rural hospital newborn delivery.
Thank you, sir. The fourth item I'm presenting today for initial adoption is an increase in the existing payment for the newborn delivery program. Again, pursuant to the budget bill passed in 2025 and pending approval from the Centers for Medicare and Medicaid Service, DCH proposes to increase the rates of the add-on payment for rural hospital newborn delivery from $1,000 to $3,000 per delivery effective July 1st, 2025. For the board and public notice, rural hospitals will continue to be designated as located within counties having populations of less than 35,000 people. The cost impact for this change is expected to be $1,747,837 in state funds, with a total fund impact of $5,188,000. An opportunity for public comment will be held on May 27th, 2025 at noon via Zoom audio. Comments are due to the department on or before June 3rd, 2025. I'll pause again for any questions and will respectfully request your consideration for initial adoption, the increase in existing payment for the newborn delivery program.
Any questions for Brian? Hearing none, is there a motion for initial adoption?
So move, Hopkins.
I have a motion for approval. Is there a second?
Norm Boyd, second.
I have a second from Norm Boyd. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
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 Any opposed, no. Anyone abstaining? Motion carries. We move to the next item, which is the establish a new category for payment in the rural hospital newborn delivery program. Brian?
Thank you, sir. The next item I'm presenting for initial adoption is the establishment of a new category of payment in the rural hospital newborn delivery program. Again, this is in accordance with the previous legislative budget instructions and pending approval by the Centers for Medicare and Medicaid Services. The Department of Community Health seeks to add an additional designation and payment for the newborn delivery program. Currently, as we just discussed, there's an add-on payment for for newborn deliveries in hospitals with a population less than 35,000. Effective July 1st, 2025, the department seeks CMS approval for an additional designation to provide an enhanced payment to hospitals for newborn deliveries in rural counties with populations between 35,000 and one person and 50,000 people. The department seeks to set the rural hospital newborn delivery program add-on payment for these hospitals at $1,500 per delivery. The cost impact for this change is estimated to be $2,165,425 in state funds, with a total fund impact of $6,427,500. An opportunity for public comment will be held on May 27th, 2025 at 2:30 PM via Zoom audio. Comments are due to the department on or before June 3rd, 2025. I'll pause now for questions and will respectfully request your consideration for initial adoption, the establishment of a new category of payment in the newborn delivery program, rural newborn delivery program.
Any questions for Brian? Hearing none, is there a motion for initial adoption?
Norm
So
Boyd,
moved.
so moved.
Seconded.
I have a motion and a second for initial adoption. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
Aye.
Anyone opposed, no. Motion carries. Okay, we'll move to the next item, which is the increased reimbursement rate for neonatologists and maternal fetal medicine specialists. Brian?
Thank you. The next item I'm presenting for initial adoption is increase in reimbursement rate for neonatologists and maternal fetal medicine specialists effective July 1st, 2025. Pursuant to budget instructions in the 2025 legislative session and pending approval by the Centers for Medicare and Medicaid Service, DCH seeks to modify the state plan to provide an increase for specified codes for neonatologists and maternal fetal medicine specialists effective July 1st, 2025. The rate increase for the select codes is 8%. I want to pause here and state that the preliminary board notice we passed out to the board does require modifications. So we're going to have those modifications out to you guys shortly and before it goes out in general. But the rate increase for those specified codes will be 8%. The cost impact for this change is estimated to be $1,914,467 in state funds, with a total fund impact of $5,682,614. An opportunity for public comment will be held May 28th, 2025 at 9 a.m. via Zoom audio. Comments are due to the department on or before June 4th, 2025. I'll pause now for any questions and request your consideration for initial adoption in the increased reimbursement rate for neonatologists and maternal fetal medicine specialists.
Any questions for Brian? Hearing none, is there a motion for initial adoption?
So moved.
I have a motion for initial adoption. Is there a second?
Norm Boyd, second.
Thank you, Norm. We have a second. Any further discussion? Not. All those in favor by aye.
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 Any opposed, no. Anyone abstaining? Motion carries. Thank you. We'll move to the next item, which is increased reimbursement rates for select dental codes. Brian?
Thanks, sir. The next time I'm presenting for initial adoption is an increase in reimbursement rate for select dental codes effective July 1st, 2025. Pursuant to budget instructions in the 2025 legislation session and pending CMS approval, DCH plans to modify the state plan to provide an increase for specified codes for dental services. Due to the number of HCPCS codes, the actual codes we use for billing, we're going to refer the board to the list of codes that have old rates and new rates in the public notice. As you guys will see, there's quite a few codes that are increasing under our dental program. The cost impact for this change is expected to be $1,597,381 in state funds, with a total fund impact of $4,770,118. An opportunity for public comment will be held May 28th, 2025 at 10 a.m. via Zoom audio. and comments are due to the department for this board notice on or before June 4th, 2025. I'll pause for any questions and will respectfully request your consideration for initial adoption on increase in reimbursement rates for select dental codes.
Any questions for Brian? Hearing none, is there a motion for initial adoption?
So moved,
Sure.
Norman Boyd.
Have a motion for initial adoption. Is there a second?
Same Mobley seconds.
Mr. Mobley has seconded. All those in favor of the motion signify by aye.
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 Opposed, no. Anyone abstaining? Motion carries. Thank you. Okay, we'll move to the next item, which is increased reimbursement rates for select primary care codes.
Thank you, sir. I'm presenting for initial adoption an increased reimbursement rate for select primary care codes effective July 1st, 2025. This is again in accordance with the budget instructions we got at the last legislative session and does require a state plan amendment to CMS. The codes that are impacted are 99213 and 99214. These codes are for office or outpatient visit for low or moderate medical decision-making. Low MDM 99213 is going from the current rate of 8205 to 8382, and moderate MDM is going from the current rate of 115.71 to $118.20. The cost impact for this change is expected to be $3,791,635 in state funds, with a total fund impact of $11,322,645. An opportunity for public comment will be held May 28th, 2025 at 11 o'clock a.m. via Zoom audio. Comments are due to the department on or before June 4th, 2025. I'll again pause here for any questions and request your consideration for initial adoption of the increased in select codes for primary care.
Any questions for Brian? Hearing none, is there a motion for initial adoption?
So moved.
Have a motion for initial adoption. Is there a second?
Second.
And we have a second. All those in favor of the motion signify by aye.
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 Any opposed, no. Anyone abstaining? Thank you. We'll move to the next item. And that is increase for privately owned intermediate care facilities for individuals with intellectual disabilities. Brian?
Thank you, sir. It's my last one, I promise y'all. The final item I'm presenting for initial adoption is a rate increase for privately owned intermediate care facilities for individuals with intellectual disabilities effective July 1st, 2025. This is again pursuant to the budget instructions in the previous legislative session, and it is pending approval by the Centers for Medicare and Medicaid program with a DCH modification to the state plan. DCH intends to provide a rate increase for privately owned intermediate care facilities for individuals with intellectual disabilities. The rate specified is in the public notice is a per diem rate. The rate is increasing from $240.58 to $280.01. The cost impact for this change is expected to be $500,000 in state funds, with a total fund impact of $1,484,120. An opportunity for public comment will be held on May 28th, 2025 at noon via Zoom audio. Comments are due to the department on or before June 4th. I'll pause now for any questions and would request your consideration for initial adoption for an increase in the reimbursement rate for privately owned intermediate care facilities for individuals with intellectual disabilities.
Any questions for Brian? Is there a motion for initial adoption?
So moved, Norman Boyd.
Norman Boyd has made a motion for initial adoption. Is there a second?
Second, Hopkins.
There is a second. All those in favor of the motion signify by aye.
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 All opposed, no. Anyone abstaining? Motion carries. Brian, thank you. I suggest you may take the remainder of the day off after all this presentation.
Thank you, sir. You hear that,
Thank you.
Commissioner, right?
That's right.
Next item on our agenda is from Louis Amos, who will give us a presentation on school personnel board resolution from the state health benefit plan. Louis?
Good morning, Chairman Folsom, Commissioner Carlson, members of the board. I respectfully submit to you the resolution in accordance with the budget approved for the Appropriation Act, which establishes the employer contributions for both the teachers plan and for the public school employees plan. So effective with the fiscal year 2026, the teachers plan contribution for the employer portion for library employees will be set at $1,885. The employer contributions for non-library employees will be set at $1,885. And the employer contributions for those who are in the public school employee plan will be set at $1,885. I pause now for any questions and respectfully ask your adoption of this resolution.
Any questions for Louis? Hearing none, is there a motion for adoption?
Same Mobley motion.
Second.
I have a motion and a second. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
Aye.
Any opposed, no. Anyone abstaining? Motion carries. Thank you, Louis.
I thank you for your support.
Next item on the agenda is a legislative update from Brandy Sylvan, who's Director of Government Relations. Brandy?
All right, good morning. Thank you, Chairman Folsom, members of the board, and Commissioner Carlson. I appreciate the opportunity to present to you today a high-level overview of legislation that passed during the 2025 session of the Georgia General Assembly. I will be discussing legislation that will have a direct impact on the department. The 2025 session ran from January 13th to April 4th. During this period, our office tracked over 200 bills that were up for consideration. That process includes identifying bills as they are introduced, providing departmental feedback on the impact of various considerations from both a policy and financial perspective, and monitoring bills for changes throughout the legislative process. As part of my presentation, I'm going to highlight bills that passed this year, which will have an impact on DCH. The board can expect to see some rule changes presented for consideration over the coming months as directed by this legislation. The first set of bills are proposals that were submitted by DCH. House Bill 584 reassigns the licensing and oversight of drug abuse treatment and education programs, narcotic treatment programs, community living arrangements, and adult residential mental health programs from DCH to the Department of Behavioral Health and Developmental Disabilities. Both agencies are working together to ensure a smooth transition of these programs by the January 1st date established in statute. Senate Bill 276 was introduced following a directive from the Centers for Medicare and Medicaid Services requiring all states to have this language in state law. The bill prohibits liable third-party payers from denying payment to Medicaid for healthcare services based solely on a lack of prior authorization. The bill also requires insurers to respond to inquiries from the state regarding the status of claims within 60 days of receipt of inquiry. The next group of bills are bills that passed and will have an impact on the agency's operations. House Bill 113 would repeal existing provisions related to state contracting restrictions with foreign entities and instead require the Georgia Technology Authority to maintain a list of concerned goods produced by foreign companies of concern, which are deemed by GTA to pose a security threat to the state or its residents. Concerned goods may include component parts, services, or technology. State entities are prohibited from purchasing these products or services. House Bill 196 requires state health benefit plan insurers, including pharmacy benefit managers, to reimburse pharmacies for drugs dispensed to covered persons in an amount equal to the national average drug acquisition cost, or NADAC, on the day of claim administration. The bill also requires that SHBP insurers pay a professional dispensing fee of at least $10.50 to chain pharmacies and $11.50 for independent pharmacies. If NADAC pricing is not available, the drug shall be reimbursed at a discounted percentage of the average wholesale price or wholesale acquisition cost on the day of claim administration. House Bill 197 requires insurers as part of the utilization review process to allow providers an opportunity to schedule a time for peer-to-peer communication to discuss a patient's treatment plan in the event a clinical peer is not available upon first contact. The bill also requires insurers to implement a program that reduces prior authorization requirements for providers based on established quality metrics. Beginning July 1st, 2026, all insurers must submit an annual report to the Office of the Commissioner of Insurance and Safety Fire, detailing the criteria they established for the program, a list of procedures and services subject to the program, the number of participating providers, and any other information as established by OCI. House Bill 352 adds patients with gestational diabetes to the list of those eligible for coverage of continuous glucose monitors under Medicaid. House Bill 422 requires the state employees' health insurance plan to allow certain employees enrolled in a high deductible health plan to make pre-tax contributions to their health savings accounts by January 1st, 2026. The bill also directs SHBP to offer at least 2 high deductible health plans by January 1st, 2028, provided that at least 2 cost-neutral bids are received during the procurement process. House Bill 567 authorizes teledentistry in Georgia, allowing Georgia licensed dentists and dental hygienists to provide remote dental care using telehealth technologies under regulated conditions. Section 2 of the bill allows insurers, including Medicaid care management organizations, to provide coverage for teledentistry services. House Bill 645 removes the COVID-19 baseline testing requirement for residents and staff in long-term care facilities. The bill also lowers the age at which hospitals must offer an influenza vaccine to discharge inpatients from 50 to 18. Part 1 of Senate Bill 5 contains the same language that I already reviewed in House Bill 197, which requires insurers to implement a program that reduces prior authorization requirements. Part 2 of the bill requires that the state health benefit plan require coverage for healthcare services related to PANS and PANDAS beginning January 1st, 2026. PANS and PANDAS are autoimmune neuropsychiatric disorders in children that present following a strep or other infection. The bill requires that coverage align with nationally recognized clinical practice guidelines. Senate Bill 12 amends Georgia's public records laws to clarify provisions related to accessing public records, particularly those held by private entities. The legislation defines a records custodian as an agency that has charge and control over a public record and specifies that all public record inspection requests are made through the custodian. The bill further requires that private persons or entities who have prepared, maintained, received, or been transferred public records on behalf of an agency produce those records when requested by the custodian. Senate Bill 96 makes modifications to statewide boards, advisory councils, commissions, and other similar bodies. Some bodies are abolished while the composition, appointment procedures, member terms, and requirements of other bodies are revised. Administrative support for the Georgia Council on Lupus Education and Awareness will transfer from DCH to the Department of Public Health. And the Palliative Care and Quality of Life Advisory Council will be abolished. Finally, I will highlight some of the study committees that were adopted this year. Study committees often provide insight into legislative priorities for the upcoming session. House Resolution 611 creates the House Study Committee on Abandoned Child Placement following hospital discharge. The committee will conduct a gap analysis of community services and resources provided by the public, nonprofit, and private sectors to better support minors being discharged from psychiatric hospitalization, acute hospital emergency rooms, and other types of out-of-home care. Senate Resolution 393 creates the Senate Study Committee on Improving Family Caregiver Services. The committee will examine the demands placed on family caregivers of seniors to determine policy goals and identify legislative actions to improve family caregiving. And I'll be happy to answer any questions if you have any.
Any questions for Randy? Well, hearing none, Brandy, thank you for that excellent summary of all the legislative action.
All right, thank you so much.
Commissioner Brandy, I want to ask you a question real quick. This is
Yes, sir.
Shane about the pharmacy benefit manager part on the one that passed. Go back through that again because you had a lot that you were going through, and that's been sort of a hot button topic. Would you be kind enough just to clarify that a little bit? I know on the dispensing, it's $11 or so for the independent and $10 for the national chains. But can you go back and sort of say again what that did? I'd appreciate that.
So the goal is to create a little bit more of a standardized reimbursement mechanism, which was why that NADAC pricing is what is in the statute. It's a national average drug acquisition cost. And so the bill is saying that the PBM representing SHBP would be reimbursing at that NADAC cost. And then, as you said, the dispensing fee for chains would be $10.50, and for independents would be $11.50. The rest of the language was just in case there is a drug that NADAC pricing does not exist. It's sort of the alternative pricing if NADAC is not available.
Okay, so for an example, does this address the disparity between what CVS pays themselves now, being the PBM and the pharmacy, versus what the independent pharmacy? I just want clarity on that. So let's just say, there's a drug they reimburse themselves at 50, and in a lot of cases they're reimbursing the independents like $1.50 or $2 for the same drug. Does this law change basically affect that as well, or just the dispensing part of that? When you say acquisition costs, you mean what they're literally paying for the drug, correct?
Correct. That is the reimbursement mechanism for the drug cost itself.
But not the reimbursement for the actual drug. So can you give us an example that you can think of that might, so that we can sort of wrap our minds around that? So for instance, yeah, just give us, so the reimbursement cost. So if a pharmacy has to buy that drug from the PBM, right? Let's say $10 or whatever like that. They may actually charge the state health benefit plan $20. Is that right for that same thing?
So it's standardizing the reimbursement of what the PBM is paying the pharmacy for the drug that they have dispensed.
Okay. So basically So are you saying that if CVS as the PBM pays themselves $20 for that drug, the independent pharmacy is also going to get paid $20 for that drug?
Right, regardless of what type of pharmacy it is, it's going to be that NADAC pricing.
Okay, so that'd be the standard pricing for that. All right, and I know the dispensing fee is one thing, but I don't think, because I know a lot of times what CVS is doing over the independents, they try to get them into the 90-day, or like these long-term filling type things, so that they'll only have one dispensing fee versus having multiple dispensing fees per month. But it sounds like to me what you're saying, we're not regulating that. It's just basically we're making the standard, it's more standardized pricing for the state health benefit plan part of things.
Yes, sir. This legislation did not address that specifically. It's just
Okay.
about that standardized reimbursement methodology.
Okay, because I know that's a really big deal for a lot of the independent pharmacies. So that's pretty good news. Thank you.
Yes, sir.
Thank you, Shane. Any more questions for
Yeah,
Randy?
yes, this is Tommy. What was the dispensing fee before the increase to $10 and $11?
I'm not sure, but we'll be happy to find out and follow up with you on that.
Well, thank you.
And that,
I think
That's-
probably it was substantially less, and it was also varied per prescription, per the drug used in the prescription.
yes, sir. And to follow on that, what the bill between the standardization that NADAC, an index that is accepted across the industry and actually kind of derived by pharmacist surveys. So between that and the dispensing fee and the bill, you kind of create a new floor, and the dispensing fee is always going to be kind of subject to the appropriation. So in the event the pharmacy community sees some disparity growing, or just some market factors that suggest they could use a little more reimbursement assistance, as many groups do, they were able to go to the appropriators to seek additional funding in the dispensing fee. So it creates parity with the new floor, but there always, should market forces, the economy dictate, just like other rate setting that goes on in this meeting, also, they're able to go down and seek further appropriation to get to the dispensing fee side for an increase.
My understanding from the sponsors of the bill, it was a step toward equalization, and that's where it's headed. It may not satisfy all areas of equalization, but it's a step in that direction.
Yes, sir. There was a great deal of alignment, thanks to Brandy and Grace, and SHBP team, Dr. Berg, a lot of others. We were able to seek a lot of consensus between the pharmacy community and legislators, and also making sure that SHBP's fiscal best interests are kept in mind too. And we were able to strike a balance that hopefully moved the needle. So,
Any further questions for Brandy?
No, Brandy, excellent work. Thank you so much. We really appreciate you.
Brandy, thank you for that excellent presentation.
Thank you, Chairman.
The next item on the agenda is an informational update on the directed payment program from Cody Whitlock, Chief Financial Officer. Cody?
Good morning, Commissioner, Mr. Chairman, members of the board. As we prepare to submit the preprints to CMS for SFY 26, the department is planning to maintain the overarching aspects of our DPPs. The only substantive change that we're really making is we are advancing the Medicare cost reports that contain the eligibility information. Advancing the cost reports adds 6 hospitals to our STRONG program. And the criteria within that is to have over 5 graduate medical education FTEs, full-time equivalents. So these 6 hospitals will exceed that count when advancing the cost reports. And this will bring a total of 29 teaching hospitals into the program across all tiers. I'm happy to answer any questions.
Any questions for Cody?
Who's driving the increased teaching hospitals? What what person or what group is handling that? I had to do that while on the Board of Regents. So I was wondering who's handling it now.
Yes, sir. I would say the best is really no one. In particular, it was kind of a critical mass issue throughout the summer and fall. The legislature as a whole began to express a lot of interest in further GME investment. And so it was something going into the fall that we knew there was some legislative interest in some sort of appropriations appropriations action on this issue. And while DPP is a little bit outside the appropriations process per se, this is a good complement to what the legislatures wanted to see happen. So.
Good. It's a very complex issue that is not going to be easy to accomplish.
Yes, sir. We learned a lot through that exercise. It is very complex and braided throughout multiple entities across the state and the federal funding piece too.
Any further questions for Cody? Cody, thank you for that presentation. Well, that brings us to any new business. Is anyone aware of that we should entertain? If not, I want to say, as past Chairman Boyd would always say, quite a bit of due diligence has gone into these items. I know we handle some of them rather rapidly, but a lot of due diligence has gone into this, and we recognize and appreciate that. And I want to thank the board members for their attention and participation this morning. I know we had a few that could not be present for the meeting, so we appreciate all of you that were and participated. Our next meeting will be June the 12th, and we look forward to seeing you then with some more agenda items. And I don't know what the record is for initial adoptions, but we might have come close to it this morning. So thank you, and everyone have a good Monday. Thank you.
That's right.
Meeting
Thank you.
adjourned.
Thank y'all. Bye-bye.